Mr. President, I rise today on the Senate floor to help initiate an important discussion about health care, the enormous need for fundamental health care reform, and an important debate about what principles we should follow, what model we should use in furthering this vital and necessary health care reform. This is a class project, if you will, and I'm joined by many members of my Republican class here in the Senate, specifically Senators Burr, Coburn, DeMint, Martinez, Thune, Corker, and Isakson. And all of us will be coming to the Senate floor and coming to other forums over the next 8 weeks to talk about this vitally important issue. Mr. President, I think on some points there is near unanimous agreement among Americans. Points like our health care delivery system and finance system truly is broken. Health care is not available or affordable to far too many Americans. The uninsured problem in this country is extremely worrisome, and just as worrisome, quite frankly, is the challenges that some insured folks face in terms of keeping their insurance among in the face of dramatically rising costs. On these points, like I say, Mr. President, I think there is near unanimous agreement. And so that leads us to a conclusion that virtually every American has reached. We need to act. This is a very real concern of every American family, and those of us in the Congress need to come together in a spirit of bipartisanship with open minds and act on this crucial issue. As we do so, though, Mr. President, I think it's very important to lay out what our choices and models, what the alternatives are. And as I said, that's what I'm doing with my fellow Republican classmates, to lay out a particular vision of what that reform can look like, what it should look like, what principles it should embody. And again, I want to recognize and thank Senators Burr, Coburn, DeMint, Martinez, Thune, Corker, and Isakson for joining me in this effort. They will join me tomorrow at the Heritage Foundation to do a similar kickoff, to talk about this important debate, to talk about the principles we should follow and the choices that we do face. And as I said, we'll lay out over the next 8 weeks what we think that vision for a sounder, healthier future should be. We're going to start that discussion, Mr. President, by talking about guiding principles. Before you get to specifics, before you get to proposals, before you get to bills, you need to have a sense of what you think the guiding principles for reform and positive change should be. And let me just start the discussion off by suggesting some of those core guiding principles that I share with my Republican classmates who are coming together on this issue. We believe a number of significant things. First, we believe that individuals and families should be in control. Individuals and families should own and control their own health insurance rather than have the government mandate something on them. That's perhaps the first and most basic and fundamental guiding principle. In concert with that, we believe that individuals are capable of and better at choosing their own health insurance plan than government bureaucrats or insurance bureaucrats. And that goes hand in hand with empowering the individual and empowering families. We believe that the current cost of health care regulation makes access to health care unnecessarily expensive for everyone and lowers quality. Everyone acknowledges the current high cost of health care. We believe that a huge part of that is the cost of health care regulation. We believe that existing government programs can be improved and modernized and made more efficient, and that should happen. But we also believe that part of that shouldn't be dramatically expanding those programs to cover far more classes of individuals and more income levels than was originally proposed. We believe that encouraging competition in the marketplace is the key to lowering health care costs. And that's, again, goes hand in hand with empowering individuals, empowering families, giving them choice, not dramatically expanding the government sector. We believe and recognize that seniors have increasingly turned to Medicare Advantage plans because, in so many cases, they offer a better value and a higher quality of care for traditional fee-for-service Medicare. And so we strongly support that option, not making it mandatory, but that option in terms of the future of Medicare. And finally, Mr. President, we believe that taxes should be as low as possible and the tax code should be changed to actually give more power to individuals, give more power to families in choosing and buying and owning their own health. You acknowledge the enormity of the issue, the need for fundamental change, which almost all of us do. Once you lay out guiding principles, fundamental core principles which should help chart our future, then you can more fully get to the choices there are and the debate that we need to have in the Congress, in the Senate and the House, and much more broadly in the country. And over these next 8 weeks, we're going to be highlighting those choices and those differences. I think this is very important to do, perhaps particularly in a major election year, because as we lead up to the fall elections, these choices, in fact, are going to be a big part of our choices for candidates for president, for candidates for the House, and for the United States Senate. And so over these next 8 weeks, my colleagues and I will be talking about not only our guiding principles, what vision that sets out, but also the fundamental choices that we have to choose those guiding principles, that vision and that model, or to choose a very different government-dominated model. So we'll be talking about some of those choices. Number one, running health care by the federal government or empowering the individual through privately owned insurance. Fundamental choice that's at the center of this debate. Number two, forcing certain types of enrollment in large national or government programs versus expanding opportunities for individual choice. Number three, mandating requirements, which are often expensive mandates that add to the cost of health care through health care regulation, versus creating more choice and alternatives and flexibility, which can both empower the individual and lower costs. Number four, how we deal with seniors, whether we take away their choices in Medicare Advantage and in drug plans, or we keep and even expand their choices in these and other areas. And finally, number five, raising taxes to support a government-dominated model versus tax fairness, lowering taxes or creating tax deductions or credits which empower individuals to choose and buy and own good coverage. Again, Mr. President, that's a quick preview of the next 8 weeks of our discussion and of some of the clear and quite stark, in some cases, choices we face as we have this debate. Mr. President, close the system to give all Americans accessible, affordable, high-quality health care.